Chief Minister Naidu has sharply criticized private hospitals over the state's high rate of caesarean deliveries. Speaking at the State Assembly, he described the trend as dangerous and unnecessary, particularly when natural or normal childbirth remains a safer and healthier option.
Caesarean deliveries. It is a dangerous trend. This is highest among all states. అంటే 90% సిజేరియన్ అన్ని ప్రైవేట్ హాస్పిటల్ జరుగుతున్నాయి. నవ్ ఐఎమ్ ఆస్కింగ్ హెల్త్ మినిస్టర్ని వాళ్ళందరినీ పిలిపించి చెప్పి ఈ ప్రభుత్వం దీన్ని ఏమాత్రం కూడా ఆమోదించాం. సేఫ్ డెలివరీ యోగా కూడా నేర్పించే పరిస్థితి రావాలి. ఇప్పటి నుంచి దాని మీద శ్రద్ధ పెట్టాలి. ఎప్పుడు కూడా ఆపరేషనే. భగవంతుడు ఇచ్చినటువంటి నేచురల్ బాడీని కట్ చేయడం కరెక్ట్ కాదు. అందుకని దానిపైన కూడా శ్రద్ధ పెడతాం.
Latest data shows that Andhra Pradesh now performs C-sections in 56.62% of all deliveries, one of the highest rates in the country. Chandrababu highlighted that private hospitals are responsible for the majority of these operations, with 90% of surgical births taking place in private facilities. The Chief Minister also pointed out that some C-sections are being scheduled based on auspicious timings, or in the south we call it muhurtams, or convenience rather than medical need, raising concerns about the over-medicalization of childbirth. He noted that public health funds, including through the Dr. NTR Vaidya Trust, are being heavily spent on these procedures. The government now plans to engage with private hospitals to ensure surgical deliveries are performed only when it is medically necessary, while prioritizing natural births. Health Minister of Andhra Pradesh, Y. Satyakumar Yadav, has been directed to take steps to reform maternal health care and safeguard both the health and choice of mothers. The big debate, of course, is, are high C-section rates a matter of women's choice and control over their own bodies, or are they a reflection of private hospitals monetizing healthcare, prioritizing profit over patient well-being? When surgical procedures are meant to advance maternal health, are they truly improving outcomes or introducing new risks? Let me now go through Deepak Reddy, who is the national spokesperson for the TDP. I also wanted a doctor, and I'm sure we will be joined by one. But as of now, Deepak Reddy is with us. Deepak Garu, thank you so much for joining us on this debate. I thought it is one of the most important conversations that all of us need to have, and it's not just about women, it's also about the men. Now, it is also concerning that the C-sections have increased. But I want to ask you, Deepak Reddy, here is a woman who's had 2 C-sections because I cannot give birth, and I'm saying this on national television, and it's my example. I can't give birth naturally. I don't have that option. Now, don't you think by saying such a thing, Naidu Garu is also taking the option away from us, from women like me, particularly in villages where a lot of maternal deaths happen because a woman cannot give birth naturally, Deepak Garu?
A very good evening, Sudhaji. This is the only time I would like to take the liberty to just go into the background a bit and then come to this point.
Yes, sir.
When COVID actually hit, then the Chief Minister of Andhra Pradesh was Jagannath Reddy. And Chandrababu Naidu ji realized that he was not taking it seriously, and he came up with a certain proposal on how to, handle that situation. So in continuation to that, we had a whole bunch of doctors who were enlisted with the party when we were not in power, and we came up with an app where all our party cadre would use, and their health would be monitored on regular basis, and including diet was being prescribed. So this was the level of detail which was done when we were not in power. After coming to power, Chandrababu Naidu ji has looked at the entire health sector and suggested a lot of changes because of the overuse of medicines and misuse by certain medical practitioners. So he has suggested a change in the lifestyle, like in, getting in yoga, then focusing more on preventive practices, and then use of AI. And now, recently, now we have come up with a new policy, the first in India, where 25 lakh insurance would be given universally to all the people of the state, They can just go into any hospital up to 25 lakhs, or everything would be covered. And now immediately, currently another 110 medical students are being added. And we're coming out with PPP model to further improve efficiency of government hospitals and government functionaries. And in all hospitals of Andhra Pradesh, the new rule is going to be that 70% of all OPD and IPD services will be free, and that they will be referred by the government, and people have to be taken care of. So this is an overall view. So why this C-section thing? Now coming to this topic is, so our chief minister wants to focus on the health of the people, not just after an issue comes up, but even from before. They would like to carefully monitor. So here there has been a suggestion that the trend has been slightly more, and he felt that unnecessary surgeries are being done. So the right is not being taken away, but as a precautionary level, at whatever percentages which are actually required, and those percentages should be maintained, and misuse should not be there. Is the whole idea here?
Yeah, sure.
So
I understand that, and you clarified that the right is not being taken away. I'll tell you why, Deepak Garu, is that a lot of women are taking the choice. I mean, they don't want to go. It's not about, being a mother is not just about going through that pain. That is all very dramatized. It is about a human being going through the pain, and also the child also faces trauma due to the pull and the push when there is a natural birth. Please, I'm not sitting on judgment on normal births. Women can go ahead and have it. But then the issue is that if a chief minister says this, the thing is that, what if I can't give birth? Now you are only talking about private hospitals. Let's talk about government hospitals, right? In government hospitals, because of this diktat, as it were, or this order or this suggestion, what happens if you have, a kind of emergencies, because the doctors are saying, let us wait for 48 hours. Gone are the days, Deepak Garu, when my mother waited for 48 hours, sir. Now it's not possible. They want to give birth, and they all want to go back home, recover and go back to work, Deepak Garu. So don't you think this is a double-edged sword, as it were, Deepak?
Yeah, let me make it absolutely clear that no legislature has been done on this, and it was only merely a suggestion looking at the trends, because we are now coming out with a very innovative type of governance where we're using AI tools and digging into data and mining data, trying to improve every facet of life of the citizen. So, Chandrababu Naidu ji has been one of the first chief ministers to come out with something called the happiness index. So, and we measure happiness on 20 different parameters. So we are looking at several aspects, trying to improve the quality of life of the citizen. And some of these are just merely suggestions, and they are not something which is binding on them. It is, and as far as C-section is concerned, it is only a precaution saying that the numbers are slightly high, and one has to be a little cautious before directly jumping to it. That's pretty much what it is, Sudhaji.
So, Deepak Garu, I also want to ask you that, the Andhra Pradesh has got very high numbers, like Chandrababu Naidu said. And can we play his bite once again for viewers who've just joined us? A suggestion by Chief Minister of Andhra Pradesh, Chandrababu Naidu Garu. Let's play that bite once again.
Cesarean deliveries is a dangerous trend. This is highest among all states. అంటే 90% సిజేరియన్ అన్ని ప్రైవేట్ హాస్పిటల్ జరుగుతున్నాయి. నవ్ ఐఎమ్ ఆస్కింగ్ హెల్త్ మినిస్టర్ని, వాళ్ళందరినీ పిలిపించి చెప్పి, ఈ ప్రభుత్వం దీన్ని ఏమాత్రం కూడా ఆమోదించాం, సేఫ్ డెలివరీ యోగా కూడా నేర్పించే పరిస్థితి రావాలి. ఇప్పటి నుంచి దాని మీద శ్రద్ధ పెట్టాలి. ఎప్పుడు కూడా ఆపరేషనే. భగవంతుడు ఇచ్చినటువంటి నేచురల్ బాడీని కట్ చేయడం కరెక్ట్ కాదు. అందుకని దానిపైన కూడా శ్రద్ధ పెడతాం.
Deepak Garu, before I let you go, I want to ask you that, do you have any reasons? I mean, you must have mined data, that what is the reason that Andhra Pradesh went up like this, sir? There must be some sociological, demographic reasons.
Sudhaji, we are previous to certain internal information, and I can tell you from that, there are a few hospitals where the rate has touched 100%. The chief minister did not want to name them, but 100% going through C-section is, that is alarming. So obviously there is some degree of medical malpractice which is going on there. So as a caution, he's instructed the health minister to review the entire process and then take proper counseling to the patients also. Start implementing yoga so that they become much more healthier. So these were all only suggestions and no legislature. So that I would like to make it absolutely clear. And one should be proud, and all other chief ministers of other states also should emulate the depth at what the chief minister of Andhra Pradesh is going into. And we are having review meetings with every department. The chief minister personally reviews once every month. And once every 2 or 3 months, he's sitting with all the collectors reviewing on what is going on across the state. So that is how the governance in Andhra Pradesh is taking place at the grassroots level.